We're about to give you some important information about how to keep your mouth healthy. Since we give this information to all of our patients, and because the importance of this message shouldn't fade with time, we've prepared this introductory video. All the patients who come to our clinic say they have bad teeth. Here you can see various x-rays. The lighter areas are fillings and crowns. In some places you can also see where teeth are missing. You may notice that all the people in the x-rays, and probably you too, have their bad teeth at the sides. Even a layperson can see that these patients have started with fillings, crowns, bridges, and root treatments at the sides of their mouths. Why? Unfortunately, most people brush their teeth rather superficially, in a hurry, while thinking about something else, and they allow themselves to be misled by the fresh sensation of their toothpaste. Usually, the front teeth are cleaned adequately, but at the back, the side teeth are not cleaned properly, and this has consequences. Invisible coatings, especially in the gaps between the teeth, lead in time to damage in the tooth enamel and to inflamed gums, resulting in tooth decay and periodontitis. Thus, we start by having fillings done in our side teeth, and if you happen to receive poor dental work and no explanation of what's happening, you're likely to have no side teeth left or only rotten ones by the age of 50. As a result, the front teeth then get overloaded, and by 60, you may have a full prosthesis, false teeth, a typical tooth history. You may have noticed that some people have crescent-shaped fillings in their front teeth, as you can see in this picture. The cause of these fillings is easy to explain. The lower teeth only make contact with each other along small areas and can be cleaned effectively by brushing. The top teeth, however, have larger contact areas, and a toothbrush cannot clean them as effectively. And this is why some people start with these crescent-shaped fillings, which then get bigger and bigger. They start with small dark spots and end with root treatments and crowns. By the end of this video, we hope to show you that there's no such thing as bad teeth, but only bad explanations, bad dental work, bad oral hygiene, and bad habits. How can we help each other to break this vicious circle? Our aim is to have you learn to clean your back teeth just as well as you do your front teeth. Here are a couple of tips. 1. Your toothbrush is merely a tool in your hands. It can only clean the part of the tooth it's led to. You must also be aware that each tooth has various surfaces, a fact that is all too easy to forget. Clean the hard-to-reach surfaces first, as the longer you take to clean your teeth, the less motivated you become. So leave the easier places for last. Start with the inside surfaces of the upper and lower teeth, and move on to the outer surfaces and the chewing surfaces. Finally, end with the front teeth, which are the easiest to reach. At first, your gums will become sensitive and inflamed or even bleed in some cases. Please go on cleaning in spite of this. Tip 2. Check to see if your teeth have been properly cleaned or not. There's a test that children usually enjoy that can also be used by adults from time to time. Plaque stain tablets. You start by cleaning your teeth thoroughly, then chew a special plaque tablet. These tablets leave a colored stain where plaque coats the tooth. Stains that can be wiped away with the tongue are simply colored saliva. Whatever remains stuck to the tooth is plaque, which hasn't been removed by brushing. So you have to go over it again. By going over it again, you can teach yourself the right technique and even reprogram your head and hands too. Tip 3. The oral douche. This is an oral hygiene device which removes plaque and food remains from the gaps between the teeth and from what is called the sulcus by means of a water jet. The animation shows a cross-section of a tooth. You can see the bone, the root, the periodontal membrane, and the gums. These structures together are called the periodontium. The gums usually reach to the point where the tooth enamel gives way to the root. There they rise up and form the sulcus, an area where the gums are not actually in contact with the tooth, but are normally very close to it. The area of the sulcus can extend up to 3 millimeters. A toothbrush can only clean above the gums. The oral douche removes plaque from the sulcus, below the level of the gums. It was previously thought that an oral douche could wash bacteria deeper into the sulcus pocket, but we now know that this is nonsense. First of all, bacteria can move on their own anyway, and besides, it's a question of disturbing the way they're organized, that is, the plaque layer. Here we see the correct use of the oral douche. Hold the jet against the sulcus and move it along the teeth outwards from the back to the front of the mouth, inside and out, making sure to stop at the gaps. The gums may bleed at first, but don't give up. This is only a sign that they are inflamed. You'll see that with regular daily use, the gums will get better. At first, set the force of the water jet to what you feel is comfortable. You'll soon find yourself increasing the intensity. If you want to save yourself from false teeth, get used to a regular evening cleaning routine. Oral douche, brush your teeth, plaque check with plaque tablets, and finally rinse with a mouthwash containing fluoride. It's worth it. You'll see that when the procedure has been practiced enough, correct, effective dental hygiene comes easily. You've now learned something important, namely that there are no bad teeth, and how to perfect your oral hygiene. Remember, start brushing your teeth from the back where it's harder. Check the results with plaque tablets, and use an oral douche to remove plaque from below the gum line. Ultimately, it's up to you to give your dental health the attention it deserves. Thanks for watching. We look forward to speaking to you shortly.